Good evening. My name is Frederick Crawford. First and foremost, I'd like to thank my audience members for coming out today to listen to this important information I'm going to provide. Today's topic we're going to talk about today is sex. As you guys know, that's something that everyone would eventually come across at one point in time in their life. Sex can be a good thing or it can be a bad thing, just depending on the individual and how they're going about it. Are they protecting themselves, or are they going to go sleep with this person or the next person and they're not going to go get checked, or they're passing things on? So sex is all based off of that individual and how they're going about it. There's different types of symptoms when it comes to like STDs. As far as having sex unprotected, you can have syphilis, you can have gonorrhea, you can have herpes, you can have chlamydia. There's HIV, there's HPV. Those are all different types of symptoms that anyone can get as far as having unprotected sex and not protecting themselves as well as the individual that they're having sex with. Syphilis is something that the symptoms that it have skin rash, and the time of exposure can be 10 to 90 days. There's different type of tests that you can get done as far as figuring out if you do have syphilis, which is a blood test or a swab of sores that you may have. With chlamydia, you might have burning during your urination, you might have fever, you might have pain during intercourse while having sex. You might have pain in your testicles, and you might have vaginal discharges. The time symptoms after exposure for that will be 1 to 3 weeks. You can also go get a cervical as far as testing to see if you have chlamydia by any chance. Then you have gonorrhea, which is a burning or frequency during variation or vaginal discharge. Symptoms for after exposure is 2 to 5 days. You can have testing through penis or urine sample, or they're going to do some type of blood work in order to figure out if you have that disease. You have genital herpes, which is you might have fever, sores, flu-like symptoms, and the time after exposure would be 2 weeks. They also do blood work for that in order to see if you have genital herpes. Then we have HPV. CDC recommends 11 to 12-year-olds get 2 doses of HPV vaccine to protect against cancers caused by HPV. This is the most common sexually transmitted infection. There are many different types that causes cancer, warts. Nearly all sexually active men and women get it at some point in time. I was able to look up some statistics as well as far as Tarrant County and as far as Texas State. Per 100,000 people, chlamydia, 466 in Tarrant County and 494 in Texas State. You have gonorrhea per 100,000 people in Tarrant County, 119.3%, and as far as Texas State, 126.5%. And as far as secondary syphilis, the rate is 8.8 per 100,000 people in Tarrant County and 6.3 as far as Texas State. When I hear those numbers, that's pretty high. If you're not out here protecting yourself or helping your individual, you are adding to those numbers and you're making this disease more aware for other people to get it. You should want to protect yourself. Sex, like I said, it can be a good thing or it can be a bad thing. The best thing is to protect yourself. You don't want to be walking around with herpes or STD, any type of STD, and you're not protecting yourself. It starts with you. You can also go to your doctor as far as asking questions to see if he can help you. As far as you should want to use condoms, you can always go to any corner store. You can go to Walmart. You can go to a clinic. You can go anywhere in order to protect yourself. When you have questions, you can call. You can go online. There's all types of things that you can do to help you and your partner. Don't be the one that's out here and you're making this disease worse and killing other people. Don't be that person. You have to want better for yourself and you have to want better for your partner. The best thing that I can tell you to do is to stick with one person, have an understanding with them, and to know that, hey, it's only you and I in this thing, and no one else is going to mess this up, or I'm not going to give you a disease that you wouldn't want, or vice versa. I also have some pictures. This is the oral herpes that people use to get around their mouth. These are genital warts right here that can pop up anywhere on your body. But most important, condoms. This is something that you should want in your life, and this is something that you should need. This will help protect you from getting any type of disease. Don't forget, always wear a condom, because this is what's going to help you live and live better. Thank you for coming out today, and I hope you enjoyed this speech.